I'll get into this. So as Matthew said, we'll talk about the color-coded stages, but prior to that, oh, why is my screen not advancing? There we go. So I'll give you a little bit of a background on what the current local landscape is for COVID in the region of Waterloo, and this may address some of what Greg was talking about regarding what are the triggers for moving, because that's kind of the measurements that we use. We'll mention a couple of the changes and updates that have come from the province most recently, and then get into the color-coded stages, and we can do questions at the end as well, but I'm happy to do them as we go, as long as we're not winding up going too far over time. So these are the numbers that I have a feeling now that they've put in the color coding with some of the trigger points are going to become more relevant for people. And most of these are available on our website. And if they're not, the rest will be there shortly. So as of November 10th, when this presentation was put together, we have a positivity rate per 100,000 people, and that doing it per 100,000 people is just a way of standardizing it from population to population, so that, you know, if you're comparing Toronto to, you know, Elmira, it's not based on the total number of residents, but it's modified to show it per 100,000. So it's kind of like using a percent. Just makes it a little more relevant and relatable. Anyway, so our positivity rate, which means the number of tests that are being done and the number of tests for COVID that are turning positive, is 1.9% per 100,000. And I'll get into a little bit more about the relevance of that once we look at what the triggers are. The RT rate, or also I think is also known as the RE rate, essentially it's the reproduction rate, how quickly the virus is growing, currently is sitting at 1.4 in Waterloo, region of Waterloo, and anything at 1 or lower is better. So essentially what this is saying is that for every 1 case of COVID, we, at the rate that is now reproducing, we'll have 1.4 new cases of COVID coming out of that. So it's not sort of, it's kind of a bit of an exponential growth there. So that's why you want to see less than. You want to see less than 1 case coming out of it, which means that if there's a case, they're doing a really good job at not spreading it. Right now, we're not so great. Our daily case counts, and we have a dashboard on the Region of Waterloo's website for COVID, and I'm sure that link will be shared at the end of the presentation, or when the slide deck goes out. So that link can be shared with you, but it does show what our case counts are. And so for the week of October 15, for the month of October, we were looking at about 15 to 20 cases per 100,000 per week. For, you know what, I'm looking at that. I'm not entirely sure it was per 100,000 or if it was just total new cases. I'd have to take another look at that. But in the first week of November, rather, you can see the number's gone up. It's gone up to about 20 to 25 for last week. Now we're in the second week of November. We don't have the full numbers for the week, but I can tell you that the numbers have gone up even further. So we're now sitting at about 96 new cases in the region, just between November 7th to 9th. So for example, yesterday, on the 9th, they reported 42 new cases. On the 8th, there was 40 new cases. The 7th was 33 new cases. So in effect, in about a month, we've doubled our caseload. So you can see that the numbers are going in the wrong direction. What our experience is showing us is that the main cause of spread currently is social events and gatherings of various descriptions, and I'll look at one in a little more detail in the next slide. And currently, with the new color scheme, we're in yellow, which is the protect category, meaning we try to, we want to try to keep things from getting any worse. We want to sort of protect the stage that we're at. But our numbers are trending upwards. So, I don't want to get into the business of predicting anything, but it's not looking good at the moment. And again, we can look at what some of the triggers are and how that decision's made in a little bit. So this is an infographic that the Region of Waterloo Public Health just released. I think it was last week or the week before. Sorry, I apologize. I was on vacation last week, and I really actually try to step away from all things work related when I'm off, just to save my sanity. So I've lost track a little bit of time as well. So, but this is based on an actual case that we followed up. It was actually a house party, 21 people, that happened outside of Waterloo. It happened in a different jurisdiction, a different health unit, but it was in Southern Ontario, Southwestern Ontario. So there was 21 people at this house party. From that, there was one person there who was positive with COVID and in their infectious stage. And your infectious stage could be, we're kind of based it on like 2 days before your symptoms show up. So it is possible for people to be infectious and not know they're sick because they haven't got any symptoms yet. This is similar with the flu. The flu, it's generally been about a 24-hour period before your symptoms show up. With COVID, we're basing it on 2 days from all the science and the epidemiology that's gone on by greater brains than mine. So what this means, and this is why we keep emphasizing, don't get together with people. Doesn't matter how well you think you feel, you may be incubating something and capable of spreading it without knowing it. So within a week from this house party, within Waterloo region, we had 15 confirmed cases that arose from this one person going to a house party. So you can see the top right there, those red dots with the black around it, those were another 5 confirmed cases. So 5 cases came out of that house party, but they lived in other communities. So they took those back to their communities, and we've got no idea how much spread happened there because we have enough trouble trying to keep track of the spread that's happening within our community. By the next day, then that one positive case then spread to 3 different households, and then once you've got somebody who's infectious within a household, it quite rapidly spreads. So especially if they're living in fairly close quarters, so you can see that these fairly large households then had a significant number of new cases evolved from that, and then they had friends visiting that potentially could have picked it up and taken it back to their households. The purple dots are what we consider to be high-risk contacts. So these would be people that were spending enough time and in close enough proximity with a case that they've got a very high probability of catching COVID. So those are the types of people that we would require to self-isolate instantly once we become aware of them, because they could, again, be in that phase where they've got COVID and they're capable of spreading it, but they haven't developed the symptoms yet. And probable cases may be people that are, they got symptoms, but they just refuse to go get testing, so we have no way of confirming it for sure. So you can see all these purple dots on here were, then kind of spread to other households, to a school, a classroom, places of work. And then this is where the people we would be instructing them, public health would be instructing them, because we would have gotten their names from anybody who was a case to say, who are you in close contact with? Then we would contact them and say, stay home. So there's your employees now staying home because they were in contact with somebody who was a case, but didn't even know they were a case because they socialized. So it's really that socializing at the events is really the trigger for this. So I know there's a lot of information in here, a lot of coding, but it is available on our website. And again, the slide deck will be going out. So at this point, is there any questions on anything?
Doesn't seem to be any so far.
Okay, hearing none, I'll keep moving. So this slide speaks a little bit to what are the highest risks, and really, if you think back to that house party that was on the previous slide, it really had all 5 of these criteria in it. Close contact is the highest risk, so that's being within 2 meters distance of somebody unprotected for a significant period of time, and by significant we're talking about 15 minutes or so. So it's really not an extraordinary long period of time, but not just passing by somebody on the street. Closed spaces, so we're now indoors, it's winter, ventilation is always an issue. Windows are closed, there's not a lot of air circulation. In some places are worse than others, so that tends to contribute to sort of the exhalations with the virus in it sort of lingering in areas for a while. It's not getting air exchanged out. Crowded places, so again, you've got that greater odd of having the larger the group, the greater the chance that somebody at least in there is incubating COVID and doesn't know about it, or worse yet, they're symptomatic and they just decided to go to the event anyway. Prolonged exposure. So again, perhaps classrooms, or you're sharing a table, eating lunch with people, where you're obviously not wearing a mask, you're not protected. So again, it's that really longer exposure, longer than 15 minutes. And forceful exhalation. If you've ever wondered why we're sort of clamping down on people singing and playing wind instruments and working out in gyms and dancing, it's not because we're killjoys, but it's because as you're doing that, you're physically breathing harder, you're forcing your air out of your lungs more forcefully, and it's traveling a further distance than normal conversation. So when you put all of these together, this is, what could turn into, those so-called super spreader events where you've got, one person, but then you get a lot of cases as a result of that because you've got all these things happening at the same time. So one of the things that my team does is we work with workplaces when a case has been identified in a workplace. So what we're trying to do is determine if there was spread within the workplace, an outbreak, or is it just that this person happened to be unlucky enough that, they caught COVID from, a family member who maybe got it from somewhere or from some other outside social event. So what we're seeing when we have conversations with workplaces where they do have cases, and particularly if they have multiple cases, is a lot of the workplaces are doing a really, really good job of protecting their employees from their public and the public from the employees. So plexiglass and the masking and the face shields and the cleaning and the distancing is all great when there's a public area, but it falls down in the employee area. So things like lunch rooms, change rooms, breaks, smoking areas, carpooling. So sort of behind the scenes, there's a little bit of complacency that comes in. It's almost like they're your family and you don't really need to mask with them. Lunchrooms seem to be the worst one. People will share a lunch break together. They sit down at the same table. They've got their masks off. They're eating, they're drinking, and they're within 6 feet of each other for an extended period of time. So if you think back to that pie chart, you've got a number of those things. You're likely indoors. You're unprotected and you're in fairly close contact for an extended period of time. So then, then the spread can happen from one employee to another. Change rooms, locker rooms, that sort of thing. If it's more of a production facility where you need to have those amenities. If you've got a shift change and you've got 20 people in the locker room at the same time, then again, you've got them in there getting changed and in close proximity and likely unprotected. So we do see issues with physical distancing and masking as well, inappropriate use of masking. They may think they're wearing a mask correctly, but they're not. I was in a naturopath clinic in the community where I live just a couple of weeks ago and waiting for my appointment with one of the practitioners there. And I saw the physician or the naturopath who was the owner of the clinic come walking out from the back, and he was wearing his mask over his mouth, but his nose was fully exposed. And it wasn't just it slipped and he left it there. I was watching it for probably about 10 minutes as he was working with the admin clerk who was behind the plexiglass, well protected from the public, but he was breathing all over her. So completely inappropriate use of the mask, putting her at risk, putting him at risk. So we see that on a regular basis. And the last bullet point there is just to make you aware that the province is also stepping up some of their enforcement work. So I'll be getting into a little bit more about what happens when we do identify a case in the workplace. But the province is also engaged in this because simply we don't have enough public health inspectors or bylaw officers to get into workplaces, whether it's our health unit or any health unit. We just weren't set up for this level of compliance checks and enforcement and education, really. So the province is stepping up. They're going to be doing some outreach and education, potentially enforcement with respect to workplaces, and we're working alongside them, identifying some of what we feel are the higher risk places that may need to have a little extra attention. And I do want to emphasize that for public health, for bylaw and for, you know, any of the enforcement agencies from the province, especially with this sort of enhanced compliance checks that they're going to be doing. Education and outreach are the primary goals. This is not a gotcha. This is not an attempt to lay charges and to do heavy-handed enforcement. We recognize this is challenging and new and difficult for everybody. You know, a lot of you are learning about things that you never thought you'd have to deal with. You know, you never, you know, really had to worry about infection prevention and control. You know, how is a disease transmitted, that sort of thing. So now it's a steep learning curve, and we recognize that. So it's really about outreach and education. However, if we do see things that are just blatant disregard for worker or public safety, it will be addressed through enforcement as well. So it is Ministry of Labor inspectors that are primarily doing this, but there are some from other enforcement agencies that have got that background, because we are all authorized under the Reopening Ontario Act to do enforcement under that act. And then of course the Ministry of Labor have got their Occupational Health and Safety Act as well, that they're able to enforce under. So I'll pause there again for questions. I think I'm seeing chat things happening here, but again, I can't quite see if there's comments there that I need to follow up on, or should I save it?
No, I think Helen had lost hearing you for a moment, but nobody else seemed to. Exactly. So it's obviously Helen's problem, not anybody else.
Okay, well, hopefully Helen's back and can hear me.
Yes, she is. Yeah.
Okay.
Andy, I have a really quick question. It's Ashley from H2R. I just had a quick question. If employers wanted to contact somebody to find out if they are being compliant or they're doing the best case scenario for employees that are in the office, I know there would be no time to have them come and see the space, but is there someone we could call to ask questions and say, this is what we've done, or is it too busy? I was just wondering.
Yeah, unfortunately, it's too busy. We'd love to be able to do that, but we're, again, with the inspectors, we're just kind of run off of our feet. What we normally say is we direct you back to a lot of the resources that we've got on our website and try to work through those.
That's great.
Yeah, I doubt the Ministry of Labor has the capacity either.
Oh yeah. Yeah, they wouldn't.
Yeah.
Okay, thank you.
So another thing I do just want to mention, and it's disappointing that I do need to mention it, but it's something that started to come up in some of the outreach that we've been doing with workplaces. And two things happen when we do outreach. And again, I'll get into that a little bit more. But one is that it could be a public health nurse that is reaching out to a workplace to let them know that there has been a positive case, and they've got questions about what kind of protection do they use. You know, do they have masking? Do they have eye protection? You know, do they have plexiglass? Do they, you know, physically distance, that sort of thing? Or it could be the inspectors who are following up on anything that the nurses have flagged as a concern, and they think that we need to maybe go out and do an on-site inspection to really see what's going on and get the lay of the land. What's happened a couple of times recently now is that the business owners or administrators that our public health staff are dealing with are becoming quite aggressive and uncooperative, questioning our authority to even do this, wanting to, you know, basically challenging. And, you know, we can fully appreciate this is a difficult time and businesses are, you know, hanging on by their fingernails. So, you know, any additional you know, difficulty or threat to their operations can be what sends them over the edge. But I just kind of wanted to you know, let this group know that really we're not doing anything that we're not legally authorized to do, and we're certainly not doing it for the fun of it. The medical officer of health, Dr. Wong in Region of Waterloo, and her counterparts in every other health unit, there's 34 health jurisdictions within the province. All of them are authorized under the Health Protection and Promotion Act, which is a provincial act, as well as the Reopening Ontario Act. But primarily our authority comes from the Health Protection and Promotion Act, which has been around for decades. And it gives the public health units and the medical officer of health is the head of that, and the board of health, who in the Region of Waterloo is Region of Waterloo Council, some significant authority including quarantining people. Now, it's not something that we do very often, but we can order people to be quarantined and held. And we have done that, not for COVID, but in the past, there may be somebody with an incredibly infectious disease that has just refused to stay home and do as required. They've actually been held forcefully in a facility. It was many, many years ago, and we don't ever want to repeat that, but it was necessary. And we do have that authority. Closing businesses, if you're running a food business, you know very well that a public health inspector, if they determine something is a significant enough health hazard that's going to pose a risk to the public, we can close the business on the spot. That can extend to what we're seeing in terms of COVID as well, should that become necessary. Again, we always do an education approach first. But there have been times when people have just blatantly ignored the direction that we're given and are doing their own thing and putting people at risk, not just their staff, but the public. And that's where we really have to step in. There's a number of other actions that we can take, and pretty much it's under the Reopening Ontario Act, the Medical Officer of Health has the authority to do whatever they see fit in order to protect the public. And some of you may be aware that the Medical Officer of Health, Dr. Lowe, in the region of Peel, recently implemented further measures for controlling the spread of COVID, because he felt that even though I think they're in the red zone, there were certain things happening in his jurisdiction, such as weddings. He was limiting the, I think he banned them outright, if I'm not mistaken, like large gatherings for weddings, because they were causing such a risk to the public that he felt that step was necessary. So we do have the authority when somebody from public health is phoning to say that, a case has happened and we're asking questions and we need you to put certain things in place to protect the rest of your staff. We're doing it with the authority, but also with the intention of protecting the rest of your staff, so that you don't wind up having large numbers of staff going off and being directed to self-isolate at home for 14 days, and therefore, further impacting your business negatively. We're very, very conscious of the impact all of this does have on a business. It's not something that we do lightly, but it is necessary, because if we don't get a grip on this, then essentially it's going to run rampant throughout the community, and there may not be a lot of businesses left at the end of the day, because a full lockdown may happen at some point. I'm not trying to threaten, but that's sort of the ultimate stage that we're really, really trying to avoid getting to. So I think I've kind of beaten that horse enough, but as I said, it's always education first with us, but we can lay charges, and it may be a ticket, it may be a summons to court, where somebody then has to explain to a judge why they didn't do what they were required to do. And we have actually laid some charges and some summonses. We just haven't gotten to the court stage yet, because that's always a lengthy process. So as I mentioned, when we are working with workplaces, what will happen is a public health nurse will identify contacts. So what generally happens is somebody goes for a test, they test positive. We get the report of public health. So now we've got the name and contact information for whoever is positive for COVID. And if they say that, yes, I work at, such and such a workplace, we will then get their contact information for their workplace and reach out to them to identify if there's any high risk contacts. And again, this goes back to who have they spent a significant amount of time with in close proximity and not fully protected rather. And then that's how they get the list of who the high risk contacts are. And we also send a letter to the workplace, just sort of explaining some of this process and what all of this means. The nurses will then reach out to the high risk contacts as well and find out what was the true nature of their exposure. What, were they really within, 2 meters for a significant enough period of time that they might have acquired the disease? Was it at a time period when the person was truly infectious, or was it a sooner, earlier than that, and they weren't really at risk from that? A lot of these conversations are very individualized. One of the complaints that we've heard back from a lot of businesses is that, well, one employee got told one thing and then another employee got told something else. And that's because the circumstances are not always identical. So it may be the date, it may be the nature of the interaction, it may be, you know, something else that happened in that person's life outside of the workplace that may have been the risk factor, because they'll go into sort of a broader conversation. Who do you live with? Do you live with anybody that's got symptoms? Do you, you know, are any of them maybe a healthcare worker and they're positive? That sort of thing. So the direction that the public health nurses give to these people, it can be very, very individualized, and it seems very erratic, but there's a reason for it. So that's where some of the challenge comes in. And these are very lengthy conversations that they have. And one of the challenges we're having at public health is that the numbers of high risk contacts that a case is having now is growing significantly. So back when we were in full lockdown in the spring, one case might have maybe 2, 3 contacts, their immediate household. Now it could be an entire classroom of kids. It could be 20, 30 people. It could be coworkers. It could be roommates. You know, so significant numbers. If we find that there are 2 or more cases that are linked to a workplace, so part of these conversations are geared around finding out if the case had the opportunity to acquire COVID outside the workplace. So like I mentioned, a party, a coworker, a housemate who may be symptomatic. If there's a reasonable explanation for the employee to have gotten it elsewhere, we're not going to attribute the transmission to the workplace necessarily. So again, that's part of the screening that we do. We don't just say because you've got a sick employee, you now have an outbreak in your workplace. We need to rule out all other potential transmission. And if the only other option is within the workplace, then that may be when we declare it's an outbreak. And we're looking for 2 or more cases, and they've got to be linked. So there's got to have been an opportunity within the workplace that they encountered each other. Maybe they had lunch together. Maybe there was a shift change together where they did a handoff from one to the other, that sort of thing. That's the sort of linkage that we're looking for. If we think that, yes, one employee in the workplace transmitted it to another employee in the workplace or more, then we'll declare an outbreak. And a further information package will be provided. You'll be having conversations with further conversations with the nurses on a regular basis, as well as potentially from my inspector team as well. They may actually come out, or they may just, you know, have a phone call and review some of the mitigation procedures that you've got in place. And this is at the point at which the outbreak gets listed on our dashboard that I mentioned. So that's that web page that we have for the Region of Waterloo, the summary page. We don't normally name a workplace, but what we do name is the sort of the industry. So it could be agriculture, it could be retail, it could be, you know, trades, that sort of thing. We don't normally name a place. However, I'm sure you're all saying, but what about the Algarve restaurant that you just named last week, or a couple of days ago? I'm losing my days again. So the reason we did that, and this is the only time that we would normally do that, is if we feel that we need to notify the public of the risk for some reason. So one of the things we're always looking for is logs, patron logs, especially for gyms and a lot of businesses, retail, that sort of thing, as well as restaurants. The reason for that is, say a member of the staff in a restaurant came up positive and they were working certain nights. We would want to know who the patrons were that interacted with that person. And we'd want to phone them, and the nurses would have conversations with them to find out, are you high risk? Are you low risk? We also identify low risk contacts. So those may not have had such a degree of exposure to whoever the case was, but we'll advise them then to just self-monitor for symptoms. It's like you've encountered somebody who's positive for COVID. We don't think it was high risk, but keep your eyes open. You know, be aware of whether you develop a cough or a fever or sniffles or whatever, and then go get tested if that happens. The high risk contacts are asked to stay home and self-isolate and get tested. But in a workplace, in a place where we may not be able to get a hold of those people. So with the Algarve, they had a list of about 175 patrons in the time period that we were interested in when the staff that was working was infectious. And there's also, we have an obligation, the mandate from the province is that we will contact all of those people within 24 hours. So it's physically just not possible for our nurses to have those conversations. We just don't have enough nurses, and especially with all the work that they were doing. Quite often we will actually ask the workplace to make those phone calls, especially if it's employees, right? Because they know the people, and it's quicker and easier for them to get that message out to them. So it does help take some of the workload off the nurses. In the case of the restaurant, that wasn't an option. So we felt we needed to go to the public and say, anybody who dined at this restaurant between this date and this date at these times, just go get tested. So the restaurant has been cooperating fully, and it was unfortunate that we had to do that, but it was just necessary in order to protect the public. But that's the you know, it's the least thing that we want to do. We really don't want to do that. It's a last resort. So that's a little bit about what happens if there is a case or an outbreak identified in a workplace. But really, you'll have extensive conversations with the public health nurse, and it'll be frequent, probably daily, until we deem that there is no further risk of transmission within the workplace. So, the 14 days and the dates of exposure, and they measure all of these things. And I don't know it intimately, but it can be it can range from days to weeks when staff may be required to be off and self-isolating. So it can be a significant hit to a workplace if you're losing, if you haven't done a great job of keeping your staff separated, say in the lunchroom, you could be down an entire shift because they're all now high-risk contacts and have to stay home. So, and that's similar to what happened with, Toyota did a release to say that they've had to shut down, and essentially that's what it was that there was enough contacts that they were no longer able to function. So, and again, it was, unfortunate because that's not our goal. We're not looking to shut down a business. It was just the nature of their operation that they couldn't function without the key staff that had to stay home and self-isolate. So moving on, we can talk a little bit about some recent changes. This is just one slide, if I'm not mistaken. And then we can get into the color coding, which is, I think, what everybody's mostly interested in. So just a reminder, there is now a provincial mandate to wear masks in Region of Waterloo. We brought in the masking bylaw back in the summer, ahead of what the province required. Sometimes that's what happens, is that local health units and the local medical officers of health will sort of determine that there is a need. And then the province sort of, for whatever reason, maybe didn't want to go there first, but then they see that there's enough of a grassroots interest in it that they then make it a provincial mandate. Because in public health, we really hate the patchwork. We can do one thing in Waterloo, but they're doing something else in Guelph, and London is doing something else, because it gets very confusing, and again, confusing for businesses as well, especially if you've got operations in different jurisdictions. And you've got different rules to follow depending on where your office is. So recently there was also then mention about 3-layer masks with filters being more effective. So this is just a bit of a graphic to show you that although a lot of the masks may look similar, those that have fully gone through the ASTM rating will give you the most reliable protection. And there's a lot of knockoffs on the market right now. So again, depending on how what's the word I'm looking for, how sensitive your business is to requiring healthy staff to keep functioning, especially if you've got some key employee positions, you may want to look at trying to track down ASTM masks that are suitable for your environment. And a lot of it depends on whether there's moisture in the air or not. Generally, once a mask becomes wet, it is no longer effective. So even cloth masks, if it's a wet environment, they lose their effectiveness. They're no longer filtering anything. So if you want to have a reliable level of protection, if you can track down ASTM level masks that are suitable for your environment, that also goes a long way when you're having conversations with those public health nurses who are asking about how well protected were your staff. They will be taking into consideration, was it a medical grade procedural mask that we know has been tested and shown to be effective at filtering out certain things, versus was it a homemade cloth mask? So there's definitely different levels of protection out there. And there are resources out there. Health Canada has also published a list, and I think we're sharing the link with that, of approved masks. And then you can kind of look through those to see which ones you may be able to access or which ones you have, and if they're on that list, which is ideal. So just an awareness that not all masks are created equal. N95 masks, have been a lot in the news. They've got the maximum filtration. Trust me, that's not something that you want to wear for 8 hours a day, because it really does make breathing difficult. And those are generally reserved for people that are in medical roles dealing with patients that are infectious with truly airborne diseases such as TB. Or they're doing something that we call an aerosol generating medical procedure, maybe a dentist who's drilling on a tooth, that sort of thing. They're really in close proximity, and there's a lot of aerosols coming out of that mouth. So the color coding stages, sorry, my phone's just going off and it's my boss, so I'm just gonna have to ignore her for a bit. So this is the key slide, I think, that a lot of you will be interested in. So these are the various levels, but also what the triggers are to move to the next level. So right now we are in the yellow mode, the protect mode, as I mentioned, and it gives the criteria of what we're looking at in terms of incident rate, of cases per 100,000. Now, this is the one stat that we don't have on our website yet for Region of Waterloo. My understanding is that it's coming. To get new numbers put up on our websites, there's a lot of background work with our epidemiologists and IT to kind of get it up there and get the data clean and understandable and accurate. So I believe that is in progress. So I anticipate that I would hope within the next week or so that number may be up on the website so you can monitor it for yourselves. The percent of positivity of the testing, I already mentioned, and we're at 1.9% on that right now. The RT value, or the RE value that we use, is around 1 for that protect level. And again, we're at 1.4, so we're already a little bit higher than that. So as I said, we're trending upwards, so you can kind of see where this is heading. Repeated outbreaks in multiple sectors or settings, or number of large outbreaks is increasing or sort of staying the same. We're seeing an increase in workplaces right now, but I wouldn't say it's off the charts. And we're also seeing a level of community transmission as well. I haven't heard of any concerns regarding capacity at the hospitals, and our public health system capacity. Certainly, I know we're struggling lately because of the new numbers that we're seeing. As I said, one case has now generated potentially 175 follow-ups. That's one case alone, and we're getting 40 a day. So you can do the math on that. But I think we're still deemed adequate for that. So you can see there's different thresholds, and we're certainly not looking to, one day we're in this, in orange, and the next day we're going back to yellow, and then we're bumping up to red. That doesn't help anybody. The decision to move from one of these categories to the next is ultimately made by the province, but it is in consultation with the local medical officer of health. And as Dr. Wong, reports to the Board of Health here, which is regional council, my expectation would be, or my understanding would be, that there would be conversations happening between her and the board. She's not going to do this on a whim. There's a lot of science and data crunching and trend analysis that would go into this before we would make that leap. Ideally, my understanding is that the province would like to see see a region stay stable for 28 days in each of these before there's consideration for changing, but they're not going to wait 28 days if things are changing rapidly and you really need to kind of move through and lock things down a little bit further. So I'd say take a look at the numbers, and my advice would be ready to move to the next one. Because when it does happen, it may seem like it's happening overnight. I don't know how much lead time they're going to give, whether they're going to say on a Monday that by Friday we're in this new zone, or if it's the next day. We haven't been far enough into this process yet to know what that pattern is going to look like. But I would say, if you're going to be prudent, be prepared for the next phase. Always, whatever phase we're in, be prepared for the next one. Going back is easier because it's opening up, but that further restriction is, what's going to be the challenging one. So hopefully we don't move, but the way numbers are going, certainly across the province, and I know the Prime Minister rather was just making a call for tighter lockdowns across the country as well, sort of more aggressive handling of this. So I don't think we're out of the woods yet. Any questions on that before I move on to the next slides? No, hearing that.
Hi. I have Emily Drew-Lard here. I own a fitness facility in Cambridge. And you might be touching on this within the next slide. So if that is the case, just let me know and I'll wait.
Sure.
I'm just more so wondering, like, looking at the Waterloo region outbreak list that's on the website, and then looking to the different stages. Like, obviously I'm speaking more to my stage because that's the one that I'm most affected by. But it seems like in my industry, there's been minimal outbreak, but we're the only phase that seems to be, or the only industry that seems to be having to make major shifts already in the yellow phase, shifting from 2 meters of distance between every patron to 3 meters of distance.
Right.
So I'm just kind of wondering where there's that logic between what industries get affected based on also the outbreak that's been noted in that industry.
Right. And one of the difficulties that we have in public health is that we're trying to prevent things from happening. So if we get to the point where we've had a lot of outbreaks, then we're already too late. But if you think back to that pie chart with the 5 pieces, the one category that a lot of industries don't have is the forceful exhalation, which is what you see in a gym facility or other fitness facility. People there are working out and they're breathing harder, and they are they're breathing faster, and that is causing the droplets to spread further and faster. So that's why, the 2 meters for everybody else is for normal conversation. But because there is that level of exertion that's happening in a gym, or expected to be happening in a gym, then they've bumped that up to the 3 meters to give that extra buffer. So that would be why that is there. That's one of the ones. And they're exercising without masks, right? So we recognize that wearing a mask while you're exerting yourself is can bring other risks to an individual. So generally they are excluded from wearing masks while they're doing that. So there isn't even the masking level that is trapping the droplets.
Okay, and so then my second question on this, just kind of as an industry on Friday at 3 p.m. getting notification that come Saturday, effective immediately, we had to make these shifts, and just kind of basing it on this 1-page document particular to our industry. Is there somebody we can reach out to kind of get clarification on, for example, one of the things that there's some uncertainty on in our industry is in the yellow phase, it talks about recreational programs, but then in the red phase, it refers to like gym and fitness studios specifically. We're kind of having to make these immediate actions with minimal guidance, which as a type A planner is really challenging for me. So is there somebody we can reach out to and be like, hey, like, I don't want to spread this any more than anyone else does, but I also have a business to operate and have to pay our bills and be able to accommodate our community.
Right. At the moment, similar to the other question, we don't have anybody, we don't have sufficient staff to sort of review everybody's plans. You can certainly call in to the health unit, or just look on our website, really, and there is some guidance there. But I'll tell you, we have some of the same questions, and I know my managers who are overseeing some of these, have put that very question up to the province, like, what do you mean by a recreational program? Like, what is that? Somebody's walking on a track, but they're not involved in a program, is that excluded? But if somebody's doing it with a walking group, it's a program now. Like, so we're trying to get some of that clarity as well. And as we get it, we do try to get it up on the websites. Some of us are faster at it than others, depending on staffing levels. So it doesn't hurt to actually cruise around some other health unit websites aside from Waterloo. You can take a look at Ottawa tends to be a leader in getting information out there really quickly. Toronto does as well. Granted, they're in a different level, but they may have some clarifying statements that might be able to help you out. But I would always just suggest err on the side of caution, because what happens then if you're, and I touched on this before, if you're we recognize that these decisions then impact, the viability of your business, really. But if you wind up having a case happen and we've determined that there's a lot of high risk contacts, particularly among your staff, you may have no staff for 2 weeks, and then you may be closed permanently, or, closed for that 2-week duration, which, may or may not be the death knell for a business. So if you err, it's that preventative step. So we always recommend sort of erring on the side of caution. If you think you're on the border of whether you have to do this or do that, do the one that's a little more protective.
Okay, thank you.
So you're welcome. So this slide, and this is in that 20-page document that Greg was referring to earlier. This sort of talks about the what's applicable to the general public as a whole, all workplaces, gatherings, that sort of thing. The good news for us right now in the protect in the yellow and even in the restrict for this level is pretty much everything's as it was in what we refer to as phase 2. So the previous guidance that we had, nothing has really changed in that. So again, it's the limit of 10 people indoors, 25 people outdoors. And again, you can sort of see the logic there of outdoors has got better ventilation, better airflow, so you can have a greater number of people, say, in your backyard than you would have in your living room, because there's more air exchange, less opportunity for the virus to really go sort of directly from person to person. So all of those have fairly much stayed the same. I'll just point out the gathering limits for religious services, because this, I think, is what Dr. Lowe in Peel was getting at with his restrictions on things like funerals and weddings. Is some of the facilities, they're allowed to have 30% of their capacity indoors. Well, some of these churches and mosques and things are giant, they're giant. So, their capacity may be in the thousands of people. So to have 30% indoors can still be a significantly large group. And if it's not being adequately monitored and policed indoors, especially if, alcohol's involved, dancing is involved, meals are happening, then you can literally have hundreds of people in a more confined space. And again, that's where you get those large spreader events. So we've been working on another outbreak locally. That did start with a wedding in Peel region, and there was 100 people at that wedding indoors, and about 4 people from our community were there and were exposed and turned into cases. So it does happen. So even though the capacity is limited to 30%, it doesn't mean it is a small number necessarily. So I don't know if this is going to change. I think this is one of those that does change as we get to the higher risks. So whenever you're doing an assessment, you can start with this slide. Even though there's other slides that speak to specific industries such as restaurants and bars or gyms or personal service settings, this slide still applies as well. And then the others maybe in addition to, and that's where it can get confusing, and that's where even my staff will have difficulties. We'll be going back and forth between these. And then we have a regulation that we review as well, which is ultimately what our guidebook is. Essentially, we'll go back to the regulation because that's what we're trying to enforce. And sometimes the wording doesn't always align between this and a regulation as well. So then we're trying to really decipher what's happening. So it can be challenging, and I can sympathize that for those that are trying to figure out if you're doing the right thing, it's not an easy decision. And I'll go back to, we do education first before enforcement. So, you know, if the rules change on Friday night for Saturday, we are not going to come swooping down on you on Saturday morning and starting to lay tickets because you haven't got it right. You know, we recognize that that's not even feasible.
Sandy, I just want to ask folks
Yeah.
if we're just about at the end of our hour, but
Yeah.
we can continue on. This is really good information. And hopefully folks can stick around for another few minutes beyond 10 o'clock.
Yeah, I apologize. I've kind of gone on, but yes, I will. I don't think there's a whole lot left here. Actually, there is, but I'll whip through these. A safety plan is something that is new. There's a requirement now for businesses to have a safety plan as you move further through these. There is a template. Basically, it's just a bit of a policy and procedure. You know, if you have a positive case, how are you going to deal with it? If you know, how are you going to keep your people safe? What are some of your physical distancing measures that you've put in place? It's just to kind of make you think it through, write it out, and then have something in writing that staff can refer to should they have any questions. This is the guideline for restaurants and bars. And again, not a lot has changed, but certainly there are restrictions in place, and really you just kind of have to read through it and figure out where we're at. But my guidance or my advice is to look at the next level and prepare yourself for that. And all of these will sort of be built around that presumption of trying to keep people distanced, not having the forceful exhalation. So again, limitations on things like dancing and singing and karaoke. Alcohol is limited mainly because inhibitions then, you know, it reduces inhibitions, and, you know, we're having a hard enough time with people being complacent and in denial about this. You know, add some alcohol on top of it, and then you've really got a challenge to get people to do as they really should be doing. So that's why all the restrictions on hours and alcohol service are coming in. It just really impacts judgment. Retail. So music is another one, and you'll see that in the bars as well. And it's just again, is that forceful exhalation. You don't want to have loud music that people have to shout over in order to be heard, or they tend to lean into each other to have a conversation, getting closer than is desirable. So keeping music in bars and restaurants and retail locations down to a conversational level is what we're looking for. So yeah, I just want to reiterate, this is actually the closing slide. The rest is I just appendices in case you need them when you're reviewing the slide deck. Just to reiterate, though, that this really is a critical time for us. Our numbers are rising, and it really is in all of our hands to try and get this under control. So even if as employers you can continue to, you know, not just protect your employees and your patrons in your workplace, but have conversations with your staff about their behaviors outside the workplace. Obviously, it's not something that you've got control over, but you can provide them with information and education. We found that helpful in some outbreaks where things like carpooling were happening, and people were carpooling and outside of households, and then that's where the exposure happened. You know, some employers went so far as to provide taxi jits or Uber for their employees, so that they didn't have to carpool 4 or 5 together in a car, because then you risk losing all of those employees should one of them turn positive. So you may want to think sort of a little outside the box, a little bit outside of your scope, and what can you invest in now that's going to protect yourself and all of us later on from positive cases and potential long-term isolations for employees. So there's a link there for the full plan that we just went through, and I know this is going to be going out, and there are some appendices added as well.